Decreased appetite, controlled cravings, mild nausea. More. What do patients on Mounjaro feel from decreased appetite, blue stools, and bloating to better control over food cravings or sugary, carb-heavy meals? Early feedback shared by patients with their doctors reveals a mix of optimism, caution, and real-world insights into how this new drug can be used to reshape the obesity and diabetes crisis for Indian patients. On March 20, American pharmaceutical company Eli Lilly launched Mounjaro in India. Following its launch, doctors reported a significant rise in patient inquiries. News 18 had reported on the Mounjaro frenzy in its Health Matters edition. According to PharmaRack data, 5,400 injections of the drug were sold within just 10 days of the launch until March 31. Now, patients who started the drug have begun to feel better after a round of mild side effects and discomfort. Also, a small percentage of those who could not cope drop out. Experts told News 18 the top symptom patients report immediately after the first few doses is decreased appetite. The other mild side effects include a bout of nausea, bloating, constipation, and blue stools, in the beginning, but typically, they all improve as the body adjusts. Overall, many patients begin to see a significant improvement in fasting and postprandial after-meal glucose levels within 24 weeks of initiation, with optimal effects usually observed over 1,216 weeks as the dose is titrated upward. Popular endocrinologist Dr. Anup Misra, executive chairman at Fortis CDOC Hospital for Diabetes and Allied Sciences, told News 18 that weight loss from the drug intake is appreciable. From my patients, nobody has discontinued it. Out of about 25 people we started on it, people appear to be happy with weight loss. His patients have seen weight reduction after 3 to 4 weeks on dosage. For weight loss, a noticeable weight reduction typically begins around 46 weeks, but more substantial weight loss is observed over 36 months, with some patients achieving 10-15% or body weight loss or again more over time. However, all of this depends on adherence, dose progression, and concurrent lifestyle changes. Mounjaro, the brand name for tirzepatide, a once-weekly injectable, is a first-in-class medication that combines the effects of two naturally occurring hormones, GIP gastric inhibitory polypeptide and GLP-1 glucagon-like peptide 1. Approved by India's apex drug regulatory body, Mounjaro is a once-weekly injection priced at 4,375 rupees for a 5 mg vial and 3,500 rupees for a 2.5 mg vial, making the monthly expenditure around Rs 14,000 Rs 17,500. The drug is claimed to be 80% or cheaper than in the United States. Generally, when doctors start patients on any new drug, in this case, Mounjaro, they start with small doses and increase it every month based on how well their body tolerates the drug. Many patients experience issues like nausea, bloating, constipation, and blue stools when they start on Mounjaro. All these symptoms tend to be milder when starting with a low dose and escalating gradually. Dr. Sweta Budil, consultant, diabetology endocrinology, Fortis Hospital Mulund, Mumbai, shared about her experience while treating many of her patients using Mounjaro. However, stomach-related issues are usually self-limiting, and symptoms often subside as patients continue the medication. Around 5-10% may have persistent symptoms and may discontinue treatment. Dr. Mohit Sharma, senior consultant, internal medicine at Faridabad-based Amrita Hospital, has noticed that in the initial weeks after starting tirzepatide, many patients report a mix of optimism and mild side effects. The most common early feedback includes decreased appetite, which is noticeable within the first few doses. Also, patients come back with complaints of mild nausea, especially in the beginning, which typically improves as the body adjusts. In good news, Sharma said, patients tell him that they feel a sense of better control over food cravings, especially for sugary or carb-heavy meals. For many, it's the first time they felt physically satisfied with less food. Psychologically, patients often feel hopeful and encouraged, especially those who have struggled with weight loss despite lifestyle changes and other medications. Nanan Budhil told News 18 that the effect on blood sugar is usually seen in about a week, while weight changes take longer. If blood sugar is still not controlled and the patient is not responding to lower doses, he may need gradual dose escalation over months. This class of medicine is quite powerful for managing blood sugars. So, when we are initiating them on Mounjaro, and if the patient's blood sugars are already well controlled, we may have to reduce the doses of other anti-diabetic drugs that are on board. Otherwise, the patient may end up with low blood sugar levels. Nanan. According to Dr. Hrishikesh Salgaonkar, consultant bariatric and laparoscopic surgery, Fortis Hospital in Mulund, the efficacy of Mounjaro tirzepatide has been thoroughly evaluated in the SURPASS series of clinical trials, particularly in SURPASS-2, which compared Mounjaro to semaglutide, Ozempic and insulin therapies. In these studies, individuals taking Mounjaro at doses of 10 mg to 15 mg achieved a more than or equal to 5% or weight loss in approximately 12 weeks, whereas those on semaglutide 1 mg reached the same weight loss threshold in about 24 weeks. This indicates that Mounjaro not only leads to significant weight loss but also does so more rapidly than semaglutide. A phase 1 study from the SURPASS trial focused on weight loss, reported that individuals on the Mounjaro dose of 15 mg lost an average of 11.2 kg over 28 weeks, just above 6 months, whereas those on semaglutide 1 mg lost about 6.9 kg in the same period. The data is encouraging and shows a significant difference, highlighting the potential of tirzepatide for those struggling with weight. Swipe left for next video, but a word of caution is warranted. Overall, Mounjaro has changed the landscape of diabetes and obesity management, but it's not a magic pill. The prescription drug is a powerful tool, but like all medications, it works best when taken as part of a comprehensive approach involving dietary guidance, exercise, and close follow-up with your doctor. Otherwise, it can be as lethal as any other medication when misused, leading to serious side effects and multiple health complications. Latest blogs.